The current situation of the surgical wait list in Nova Scotia, which is among the highest in Canada and exceeds the national benchmarks. Nova Scotia is facing a serious challenge when it comes to providing timely access to surgical care for its residents. According to the Nova Scotia Wait Time Information website, there are currently more than 21,500 people waiting for surgeries across the province, ranging from cataract removal to hip replacement. This number is far above the national benchmark set by a group of medical specialty associations, which suggests that only 12,000 Nova Scotians should be on the wait list at any given time. The long wait times for surgery have a negative impact on the quality of life and health outcomes of patients, as well as on the efficiency and sustainability of the healthcare system. Some of the factors that contribute to the surgical backlog include the limited availability of operating rooms, equipment and staff, the COVID-19 pandemic and its disruptions, the aging and growing population with complex health needs, and the lack of coordination and standardization among different regions and facilities. The Nova Scotia government and the Nova Scotia Health Authority have recognized the urgency of addressing this issue and have taken some steps to reduce the surgical wait list and improve access to care. Some of these steps include investing more than $187 million in 2021-22 to increase surgical capacity and perform more than 3,000 additional surgeries compared to pre-pandemic levels. Implementing a centralized booking system that allows patients to choose from a list of available surgeons and facilities across the province. Expanding the use of virtual care and telehealth to provide pre- and post-operative consultations and follow-ups. Collaborating with private clinics to perform some low-risk procedures such as cataract surgery and endoscopy. Developing a provincial surgical plan that outlines the goals, strategies and actions to achieve sustainable and equitable access to surgery for all Nova Scotians. These initiatives have shown some positive results in reducing the surgical wait list and improving patient satisfaction. For example, between April 2020 and March 2021, more than 48,000 surgeries were completed in Nova Scotia, which is about 4,000 more than in the previous year. Moreover, according to a survey conducted by the Canadian Institute for Health Information, 81% of Nova Scotians who had surgery in 2019-20 reported being satisfied or very satisfied with their overall experience. However, there is still a long way to go before Nova Scotia can meet the national benchmarks and ensure timely access to surgery for all its residents. The COVID-19 pandemic continues to pose challenges and uncertainties for the healthcare system, and the demand for surgery is expected to increase as the population ages and new technologies become available. Therefore, it is essential that Nova Scotia continues to invest in expanding its surgical capacity, improving its efficiency and coordination, and engaging patients and providers in finding innovative solutions to this complex problem. The challenges and barriers that prevent the health system from reducing the backlog, such as limited resources, staff shortages, COVID-19 pandemic, etc. Nova Scotia is facing a serious challenge in reducing its surgical backlog, which has reached a record high of 21,500 people waiting for surgeries. This is far above the national benchmark of 12,000 people, and the longest waits are for orthopedic surgery, elective cardiovascular surgery, and gynecology. Some of the main barriers that prevent the health system from reducing the backlog are limited resources. Nova Scotia has a limited number of operating rooms, surgical beds, equipment, and supplies to meet the demand for surgeries. The province also has a shortage of anesthesiologists, nurses, and other health professionals who are essential for surgical care. Staff shortages. The COVID-19 pandemic has exacerbated the existing staff shortages in the health system, as many health workers have been redeployed to other areas of care, such as testing, vaccination, and intensive care units. Some health workers have also retired, resigned, or taken sick leave due to burnout and stress. COVID-19 pandemic. The COVID-19 pandemic has had a significant impact on the delivery of surgical services in Nova Scotia. The province had to cancel or postpone thousands of non-urgent and elective surgeries during the first and third waves of the pandemic to free up hospital capacity and resources for COVID-19 patients. The pandemic also increased the risk of infection and transmission among patients and staff, requiring strict infection prevention and control measures and screening protocols. These challenges and barriers have created a complex and dynamic situation that requires a coordinated and collaborative approach from all stakeholders involved in the surgical system. The Nova Scotia Health Authority and the Department of Health and Wellness have been working together to implement various strategies and initiatives to address the surgical backlog and improve access to timely and quality care for patients. Some of these strategies and initiatives include increasing surgical capacity. The province has invested in expanding its surgical infrastructure by opening new operating rooms, increasing operating hours, hiring more staff, and acquiring more equipment and supplies. The province has also partnered with private clinics to perform some low-risk procedures, such as cataract surgeries, prioritizing urgent and high-need cases. The province has adopted a standardized prioritization tool to triage patients based on their clinical urgency and need for surgery. The tool helps surgeons and patients make informed decisions about the timing and location of their surgery. The tool also helps allocate resources and monitor wait times across the province, enhancing communication and coordination. The province has improved its communication and coordination with patients, surgeons, primary care providers, and other health professionals involved in the surgical pathway. The province has launched a new website that provides updated information on wait times for different procedures and surgeons across the province. The website also offers tips and resources for patients to prepare for their surgery and recovery, evaluating outcomes and impacts. The province has established a data collection and analysis system to track and measure the progress and outcomes of its surgical recovery plan. The system helps identify gaps, challenges, best practices, and opportunities for improvement in the surgical system. The system also helps assess the impact of the surgical recovery plan on patient satisfaction, quality of life, and health outcomes. These strategies and initiatives have shown some positive results in reducing the surgical backlog and improving access to care for patients. According to the latest data from the Department of Health and Wellness, surgical teams across the province completed thousands more operations and procedures last year than before the COVID-19 pandemic. The department also reported that wait times for some procedures have decreased significantly since February. However, there is still a long way to go before Nova Scotia can achieve its goal of eliminating the surgical backlog and meeting the national benchmarks for wait times. The province continues to face challenges and uncertainties due to the ongoing COVID-19 pandemic, which may require further adjustments and adaptations in its surgical recovery plan. The province also needs to address some underlying issues that affect its health system performance, such as aging population, chronic diseases, social determinants of health, and health equity. Nova Scotia is committed to providing safe, timely, and quality care for its patients who need surgery. The province recognizes that reducing the surgical backlog is not only a matter of efficiency and productivity, but also a matter of dignity and human rights for its citizens. The province will continue to work with its partners and stakeholders to overcome the challenges and barriers that prevent it from achieving its vision of a sustainable and accessible surgical system for all Nova Scotians.